I worked with a doctor who the nurses hated because he was always respectful to other doctors, but he always looked down on the nurses. And his patients didn't get the care that they deserved. I learned the importance of nursing care in the first few months of being a doctor, just after I graduated medical school. It was actually a confusing time because you're learning how to be a doctor and you're responsible for the patient's care and you're responsible for writing orders, but you're pretty inexperienced. And I was going to do a procedure on a woman who was about to deliver a baby. And the nurse said to me, Dr. Luttrell, the patient's HIV positive. Should you be doing that procedure? And I realized that what I was going to do was going to increase the risk of the baby becoming HIV positive. She knew I was just an intern and an inexperienced doctor. She was teaching me. Doctors understand disease, make diagnoses, and understand treatment protocols, and the doctor's in charge of directing the patient's care. The nurse is at the bedside and is actually the one who is caring for the patient. And the wisdom that you get from caring for the patient at the bedside is far different and in many ways far deeper than a doctor will have writing orders or making decisions over the phone. As doctors, we're not actually the ones that are caring for the patient, except as surgeons, we do the operations. I make sure at hospital or in the office that my nurses are empowered and that they express their opinion to me. And I know that when I do that my patients get the very best care possible.